differential diagnosis of the narcissistic personality disorder with other types of personality disorders. First of all, the description of the narcissistic personality disorder gets complicated by various clinical syndromes, all of which have in common the narcissistic personality disorder, but are specific ways in which that disorder is organized. I have already mentioned to you narcissistic personalities with antisocial behavior, one type. The syndrome of malignant narcissism, second type. The severe, extremely severe development of the antisocial personality proper, where there is a total loss of capacity for significant non-exploitive investment in others, no capacity of any idealization of anything except one's own value, and the lack of a concept of passage of time, incapacity of learning from experience, and the total absence of feeling of guilt and concern for others and even for oneself. In addition to these three types, there are a number of other clinically important aspects of the narcissistic personality. One are certain timid narcissistic patients who seem chronically anxious, insecure, have a sexual inhibition. It's the shy narcissist who avoid trying to get involved in relation or into sexual relation because they are afraid of being rejected. Their fear of being rejected and therefore their grandiosity being challenged makes them withdraw, and the surface is timidity. And we only discover that behind the timidity and the social inhibition are fantasies of grandiosity and devaluation of others. Another type is sexual promiscuity, as I described it, the Don Juan, clear incapacity to love and replacement of love by sexual exploits that, as I mentioned, is different from masochism, in which it also presents. What happens in masochistic personality structures is that they unconsciously feel they don't deserve to be in a good love relationship. So they have to get involved into a bad one. Unconsciously, intuitively know it's going to be a bad one. And so they get into it, and of course it falls apart. They have to get into a new relationship, again a bad one. So they go from one bad sexual relationship until they find one that is bad enough so that their narcissistic needs are fulfilled, and they get stuck in that unhappy relationship. Very often that brings patients to treatment. Chronic, unhappy love relations that have a masochistic basis. The difference with the narcissistic promiscuity is that the narcissistic promiscuity is always after the search of the best, the highest, the most beautiful, the most attractive sexual other in order to have something to show their own grandiosity by this wonderful partner they have. So there is a temporary idealization that rapidly wears off because of the unconscious envy and devaluation, loss of interest, end of the relationship, and a new one with the same characteristics. Initial idealization, it's an infatuation, a temporary love relation that in its instability then leads to chronic sexual promiscuity. We find that both in men and in women, although it was originally described in men. With women's liberation and greater freedom for sexual intervention, we'll find with narcissistic women the same pattern.